And so we'll get started. So hi, everybody. For those of you who don't know me, I'm Swathi Rayasam. I'm a science associate at PRE, and I kind of coordinate the Science Action Network. And welcome to our December webinar. If you could move forward, Andrea. Awesome. So as I kind of said before, as you're getting situated, if you could just mute your audio, that would be perfect. That way we're able to hear our presenters crystal clear and our recording is able to be beautiful. If you need to unmute to ask any questions, please feel free to do so during the question and answer section. But during the presentation, just to keep our presenters kind of on track and focused, if you could put any questions or comments or thoughts into the chat, I would really appreciate that. And we'll make sure to kind of get to you. So for those of you who have been writing around these webinars with us for a while, you'll know, on the next slide, Andrea. That our agenda is a half-half agenda. So the first half is going to be our wonderful presentation by Giehae and Jessie from Johns Hopkins on characterizing pregnancy exposure to understudied toxics in the US. Then I'm going to give you some EPA updates and some TSCA updates. Courtney over here is going to round you out with some systematic review updates. And then we're going to give you some opportunities, events, and wrap up before we kick you out of here, hopefully at the top of the hour. So fingers crossed that we'll run smooth. So without further ado, if you could just move to the next slide. I'm so happy to introduce you to Giehae and Jessie. So Jessie Buckley is an associate professor of environmental health and engineering and EPI joint appointment at the Johns Hopkins School of Public Health. Her research aims to characterize exposure and health effects of environmental chemicals to inform policies to improve children's health. Dr. Buckley serves as the Director of Chemical Exposure Methodology for the Environmental Influences on Child Health Outcomes. That's ECHO for those of you who can keep up. For ECHO's Data Analysis Center at Johns Hopkins, and is a past co-chair of ECHO's Chemical Exposures Working Group. Giehae, who is wonderful, is a postdoc in the Department of Environmental Health and Engineering at Hopkins, and is an epidemiologist interested in a wide array of environmental exposures that are prevalent during vulnerable stages and approaches to better inform policy. And Giehae is calling in from Korea, so that is truly wonderful. We are really grateful that you woke up so early to join us and present on this webinar. And yeah, so without further ado, we'll kind of turn it over to Jessie and Giehae. Thank you so much.
Could you stop screen share? I think it says I can't share screen if the host is sharing. And thanks for that wonderful introduction, Swathi.
You made it easy.
Great. So yeah, we're going to do a team presentation. So I'm going to start off doing some background on the ECHO program and how we decided to undertake this work, and then pass it over to Giehae, who will talk specifically about our project on melamine and others understudied toxicants. Next. So if you're not familiar with the Environmental Influences on Child Health Outcomes program, this is a congressionally mandated, really large cohort study that is aiming to understand environmental and other influences on child health. And it is a constellation of 69 existing longitudinal cohorts that are kind of combining all of their data, and so that we have a really the largest children's health study in the US that has ever been undertaken. This is a major opportunity to fill gaps in children's environmental health research, particularly because we have large geographic, temporal, and demographic variability. And we also have a network of investigators with lots of different expertise in order to address the key focus outcome areas in ECHO. And the goal of ECHO is really to have solution-oriented research, specifically oriented at influencing programs, policies, and programs to protect children's health. Next. So at the beginning of ECHO, we formed a chemical exposures working group, and this was in 2016. And Tracy Woodruff was one of the original co-chairs of the working group and has been really involved with this work along with myself and many others and part of ECHO. And the reason that, or the main focus of our working group was really to try to be very strategic in terms of the understanding what the key gaps are in chemical exposures research in the US, and how we could very uniquely leverage the resources available in ECHO to fill those gaps. Specifically, we wanted to understand what kind of existing chemical exposures data we had from these cohorts that were existing prior to ECHO, and then understand what the gaps are, and in terms of what chemicals have not been characterized in the US among pregnant people and children, and what their health effects could be. And by combining both the existing data with some new data, we would have a very rich data platform for solution-oriented research to advance science-based action on chemical exposures. Next. So I love this slide of Tracy's that I always borrow, because I think it really shows the work that we're doing and why we're doing it. So we know that this group is obviously aware that there are many chemicals used that really, but very few have actually been studied. So of over the 40,000 chemicals actively used in the US at high production volumes, we only really know very much about around 350, at least in terms of US biomonitoring. So as a group in ECHO, we thought one of the main priorities for us would be to understand some of the hidden chemicals that are really understudied and that we know little about. Next. So I'm just going to walk through a little bit about how our group has gone about trying to inform evidence-based policy. So I've just showed the fact that we have all these chemicals in commerce that we know not very much about. So the first thing next is that we went through a very rigorous literature-based review to try to identify, we can't necessarily understand all 40,000 chemicals, but we wanted to start making some progress in terms of prioritizing the chemicals that are most in need of study. So we conducted this very thorough review, and I'll just very briefly talk about that in a minute in order to inform some of our research. And then we conducted a pilot study, which a couple of these papers were published over the summer, where we identified we're able to measure some of the chemicals that we prioritized. And Giehae is going to talk about the second paper in the second half of the talk. And then the goal of these papers is to really try to understand the chemicals that should be studied, to start measuring them in pregnant people and children, and to understand if they have health effects and what those may be, so that we can inform policy and other decision-making in terms of chemical regulations. Next. So this is very busy, and I don't expect you to understand everything going on here, and I don't have time to go into it. But essentially, this is the schematic that depicts our review that we conducted a couple of years ago that was published in EHP, led by Ido Pellizzari. But we started with kind of a universe of chemicals that could be found in people and could have health effects, and kind of narrowed it down through various different criteria to look at 155 chemicals in 8 chemical classes that we went into very detailed literature reviews to determine whether they should be prioritized for biomonitoring in ECHO. And just to note, among these are melamine and aromatic amines, which Giehae will discuss in a minute. Next. So for each of those 155 chemicals, we went through the literature to determine if there was evidence that they were found in human biospecimens, so like hair, urine, nails, or blood, or if they were found in environmental media like dust. And then we also assessed whether there was concern for toxicity. And for this, we looked at animal studies and also other laboratory studies and like high throughput screening assays, a very large set of different assays and results that could indicate whether or not there was some concern for toxicity, particularly with respect to developmental effects or cancer. And then we also looked to see if there was an available biomarker in order to measure these chemicals. And then if the answer to all 3 of those was yes, then we considered it to be a candidate for biomonitoring in ECHO. Of the 155 chemicals that we looked at, we found that 36 actually did meet all 3 of those, and we considered them high priority for biomonitoring. 108 chemicals we considered to defer, and a lot of those were because we didn't have analytical methods or they hadn't been measured in biospecimens. Among the ones that we prioritize were melamine and 3 aromatic amines. And we were really lucky in order to have a partnership with an analytical chemist and funding to conduct some of the first biomonitoring in the US in pregnant people to characterize these exposures. And this is where I'm going to pass it off to Giehae to describe this work.
Yeah, so let me talk you through a deeper dive on melamine and aromatic amines. So as you recall, these are among the priority chemicals that were selected through the process that Jessie just described. And melamine might be particularly familiar to many of you from the baby formula incident and pet food poisoning incidents in early 2000s that resulted in infant deaths as well as kidney health impacts. But we still very easily can spot products that contain melamine. So this is a photo that Tracy shared with us earlier. And you can see here that they have melamine dishware in display. And it's not just this specific store that has melamine dishware. You can see here that it's quite popular. It's selected as our favorite plates by the New York Times Wirecutter. And similar to melamine, aromatic amines are also widely used, but also known to impact kidney at high levels. And both of these chemicals are high production volume. And that means that more than 1 million pounds are produced in the US per year. And as you can see here, they're included in products that we often use in daily lives. So the probability of human exposure is pretty high. But as Jessie mentioned earlier, there's not a routine biomonitor in place in the US, and human exposure data is pretty limited. And in addition, they're also well-known carcinogens and known to have renal impacts. And in the previous echo investigation that Jessie described, these chemicals also have the potential for developmental toxicity. So in this study, we aim to measure melamine analogs and aromatic amines in pregnancy urine sample and examine what sociodemographic factors predict or explain some of the variability in these concentrations. So a total of 171 pregnant women were included in this study, and they come from 9 different echo cohorts that are diverse in terms of geographic location, as shown here, as well as race and ethnicity. So this population included high percentage of historically marginalized race and ethnicity. So we can see here that there's 40% Latina, 20% Black, 4% Asian, and 3% from other or multiple race. And most of the participants were either married or partnered and had education greater than bachelor's degree. So in these 171 pregnancy urine samples, we measured 45 chemicals in total. And this is the result for melamine and melamine analogs in box plot. So on the right here, you can see that cyanuric acid, which is a melamine analog, and melamine are detected in nearly all samples. And this is particularly concerning because in experimental settings, melamine and cyanuric acid seem to act synergistically to impact kidney health, and this could also possibly apply to human health as well. When compared to the previously reported levels, we can see here that melamine levels were pretty similar to US non-pregnant people's mean or median concentrations. But for cyanuric acid, the hollow symbols here indicate the previously reported mean or median in US adults. And we can see that the concentrations observed in our population is a bit higher than the previously reported median or mean in adults in the US, but pretty similar to the values reported in children in the US. This is a summary of the results for the 41 aromatic amines. And in our sample, 14 aromatic amines were detected in at least one of the urine samples. And on the right here, we can see here that 4 of these aromatic amines were detected in almost all of the samples. And these 4 aromatic amines are commonly used in products that contain dyes and pigments. One thing I want to bring to attention here is that the aromatic amines that are no longer mass produced in the US indicated here with a gray underline, they weren't detectable in our study population. And this probably means that having a regulatory standards that's helped with preventing harmful exposure, or at least reducing the levels at the population level. Many of the chemicals that we observed were higher in non-Hispanic Black race or Hispanic ethnicity, and also positively correlated with cotinine, meaning that smoke exposure could be a possible source for these chemicals. And for the racial and ethnic differences that we observed here, we couldn't really go further into exploring the underlying causes for these differences, mainly because the sample size was pretty small. But this calls for future research to examine what individual level factors or neighborhood or other structural factors could have contributed to these differences, and also the need to characterize exposure in other understudied race and ethnicity, such as Asian Americans, Native Americans, and Pacific Islanders. So to recap, there are 3 takeaways. And we would not have known about these exposures if the previous investigators in ECHO had not prioritized them. And this is primarily because these chemicals are not routinely biomonitored in the US, even though they're produced in high volume and used widely. And in terms of the next steps, since we saw that melamine and aromatic amines are widespread in our pregnant population, but we don't really know much about the health impacts at these low levels. We only know about the health impacts at very high levels. So there needs to be epidemiologic studies to investigate health impacts at low levels that are more relevant to these population exposures that we see here, and particularly on with regards to the health endpoints besides the commonly studied kidney toxicities. And another important area of research is to evaluate what sources or other structural factors really can explain the variability in exposure and exposure disparities. And this information can be helpful to policy and regulatory actions. And to address these 2 questions, there's currently a larger expanded measurement underway for melamine and aromatic amines in ECHO. And we plan to use this data to investigate what the predictors are and to examine whether these pregnancy exposure result in poor neurodevelopmental endpoints in children. So I'd like to end with some thoughts on actions to reduce health impacts of pregnancy chemical exposures. So research on exposure predictors and health impacts can help identify exposure reduction strategies for individuals to avoid chemical contacts and also increase public awareness. And research findings can also serve as scientific evidence that policymakers and advocates can use to make changes. But research can be make more meaningful impact when these arrows are bidirectional. So for example, researchers can engage stakeholders in the planning stage as well as research finding dissemination, and individuals could participate in advocacy activities or research. And these interactions hopefully can bring about changes in corporate and regulatory actions. And for example, when there's a strong public awareness and desire to avoid certain chemicals, this can prompt industries to phase out these chemicals or prompt the government to make more stringent regulatory standards. And an important note here is that for these actions to be effective, there needs to be changes to the current chemical regulatory framework, mainly because chemicals are regulated by how they're used and not by the chemicals itself. And a proof of safety is not that we don't really know much about the toxicity. And this can result in harm that's as bad or even worse than the chemical that's under regulation, because they probably have similar properties, but we just don't know about the toxicities yet. So to prevent this kind of regrettable substitution and ensure that public is protected from potentially hazardous substances, there needs to be a comprehensive and precautionary approach to regulating chemicals in the US. So with that, I'd like to thank the ECHO children and families and my wonderful co-authors, particularly Jessie, Tracy, and the Canon Lab, and Jordan. And to find out more, here are some more links.
Awesome. Thank you so much, Jessie and Giehae. That was really, really great. We have some time for questions if folks want. Oh, great. From Sarah. Sarah, if you want to unmute also, you're welcome to.
Okay, hi. I was just going to ask about if like the health endpoints, I know you put on the screen at the beginning, there was obesity and probably neurodevelopment. I can't remember what else, but I was specifically wondering about diabetes, and also you talked about the kidney a lot in this. So I thought, well, is the kidney on there? I don't remember what was on there.
Yeah, that's a great question. So from the beginning of ECHO, there were 5 priority health outcomes, and it's sort of, sort of birth outcomes and perinatal health, asthma and airways, obesity, neurodevelopment, and then positive health. So what kind of drives, a happy, healthy, developing child. So given this, these focus areas, there is some inclusion of sort of diabetes related outcomes in particular, where, for example, right now, getting biomarker data from children that would include kind of standard like glucose and insulin and like HbA1c. And most of the children in ECHO are, a lot of the children in ECHO are kind of between the ages of 1 and 5, but as they age, I think the idea is that we'll be able to collect more and more data. And because it's such a large cohort, we might be able to study some rarer outcomes that are not typically studied in smaller cohorts. So I hope that helps to answer your question.
Yes, thanks. And the kidney, how about the kidney? As long as
the kidney, I don't feel that I can't recall that there are any sort of specific data on that. However, we are requesting lots of, if there's like biomarkers of kidney function, we would probably get that. So there are some opportunities also to continually add sort of assay results, and then, but the protocol at the ECHO program has settled on for new data collection probably includes most diagnoses, whereas any sort of specific instruments are harder to add to the protocol.
Awesome. Thank you. Anybody else? Oh, one from Monica. Do you want to unmute her? I can also just read it. Monica wants to know if there are known safer alternatives to melamine or efforts to work on them.
As far as I'm aware, I don't think melamine is viewed that much as a toxicant at this. Well, so the IARC considers melamine as a potential carcinogen, but I don't think there are that many regulatory standards. So I'm not really sure there are research that's looking at melamine alternatives, if that answers the question.
Also, they're not like approved to be added to food or used in dishware. So I think it's partially kind of how things are getting regulated. And then I don't think we necessarily need melamine. Like there's other types of dishware, there's other types of flame retardants. So it's just a matter of understanding, well, should we be using it? Because I think there maybe are, in a lot of ways, other alternatives that could be used.
Right, because I mean, didn't we find that melamine got on the list because it's a flame retardant? It's being used as a flame retardant. So I think that just speaks to the other thing about this is people want to, I mean, the data that we use was based on whatever data EPA is collecting as part of their dashboard, and it's imperfect because people don't have to report everywhere all the different uses of the chemicals. So I think that, but when we do, we can still, we're clearly still not monitoring for chemicals that have demonstrated clear health effects and are being used in many different ways. I mean, the plastic piece of it, we only kind of like added on, discuss. I mean, that's not originally how it came into our list, I guess is how I would say. And I mean, I think the other important thing is people know it's toxic because it's already been demonstrated
And so in terms of the policy process, there's an actual specific way that this could be addressed through either state. It's just not on the radar of anybody in the United States, right? Not any state activities that are going on, nor on the regulatory agenda, such as EPA.
Yeah, just to add on a little bit, they're mainly, the FDA says melamine should not be found in food products, but they're not regulated in dishware, and mainly they suggest that you don't microwave melamine.
Right, I
dishware.
forgot about that. Don't microwave, even though people probably are, right?
Right, and that's just
Because
a
it looks
suggestion.
fine. It's like it's hard.
Awesome. Dan?
Yeah, thanks. Thanks for that great presentation. I was interested in your slide comparing your biomonitoring results to what's been found in other studies. I was just wondering a little bit about were those other studies like cohort studies were, I was wondering whether there were any other studies that measured melamine and these other chemicals sort of on a continuing population-wide basis, or whether they were just one time, and whether you'd consider these chemicals to be good candidates for addition to NHANES, or is there something complicated about the measurement methods that wouldn't lend itself well to NHANES, since I know that's sometimes an issue for them about being able to process a large number of samples.
That's a great question. Thank you, Dan. So for these melamine and melamine analogs, as far as I'm aware, I think one of the enhanced cycles measured it, but it's not like continuously being measured across all cycles. It was measured, I can't remember exactly, but it's probably like 2012 or around that time at one point. And the other dots here, like symbols here, are either from an assay that developed melamine measurement. So the adults US, the diamond shaped one, is the one that's like 19 adults, or like that small number of adults that was used to measure or like develop these assays. And these two children's cohort, I think they were from like 3 or 4 different children's cohort. And this also is not a continuous measurement. It was just like a one-time. And I think because these, at least for cyanuric acid and melamine, because they're so detected in nearly all samples, and they have previous evidence of toxicity at high levels, I think this serves as an evidence that maybe they're good candidates to be included in future NHANES measurements. And I guess I can't really speak that well to whether the assay method is very complicated or not, but the assay that was used for this measurement was developed by the Kennan lab and measures these 4 together, as well as these 41 different aromatic amines, along with cotinine biomarkers together. So it's more of an effective type of new assay method that was used.
And I'll just add they use like a different approach than are used for things like other urinary compounds. Like it's not that you can't add them. They're not using the same instrumentation as like phthalates or phenols. So it actually was quite a bit of an effort for him to develop the method. And so that might be another reason.
Okay, thanks. I know also that one of the things CDC looks for is it a method that can do lots of chemicals versus a few chemicals. So that might be something in its favor. Thank you.
Awesome. Thanks. Nick, you have your hand up?
Yeah, thanks for a great presentation, and apologies. I'm not sure if this question's been asked. My audio dropped out for a little bit. So we've talked a bit about this internally, but have there been any discussions around using this framework potentially as a way of identifying chemicals for pre-prioritization or prioritization under TSCA? Obviously, because of the chemicals you've identified here, they're obviously very widespread, but there's also the disparities that you mentioned. So yeah, just wondering if you had any discussions about how this could be used from a policy perspective under TSCA.
Do you want me to take on this question?
Good.
I was like, Tracy might.
I don't think anyone's called you, have they, about it?
No, my phone is not ringing off the hook.
Okay, there you go.
But yeah, that's an interesting idea. And we did put an awful lot of effort into this prioritization. So it would be, I think it could be used in lots of different ways by different groups. But there's so much data in the supplemental materials and all of the work that went into it. So I do hope that it gets used for other purposes, but haven't gotten there yet.
Yeah, I would say too, one other thing that's interesting about this, I sit on here. Oh, the clocks. There's some of these groups that we thought were very important. I'll tell you, we've been using them, Nick, in our in vitro, in our yeast and C. elegans assay. We use this list to help us identify chemicals to test in those assays. So some of these clocks, which come up really important, which are widely used, and there's a lot of exposures, but there wasn't a method at that point in time, or people didn't have a standard method for measuring them in biomonitoring. Is something that we thought, we should rise to the importance, but it hasn't really gotten over the hump of having more common measurements on it. I don't know if that also answers your question, but.
Yeah, awesome. We have a couple of questions in the chat. So Nicole highlights that melamine is also very common, a common material material for coating particle board on the inside of kitchen cabinets. But was wondering about the dissemination of your findings to individuals, kind of on that like different stakeholders slide, Giehae, that you were showing. How do you know if the research that you're doing is actually reaching the populations that you're studying in terms of actions that they can take? And just generally, like, what is your dissemination strategy?
While she's looking at that, I just want to say that ECHO has a whole stakeholder engagement process, but I don't think that I think this is an area where, we'd like to encourage more of the, community groups or NGO groups who are from the environmental health side to be engaged, to basically have more engagement with ECHO, because I think this is really an important point about that we're generating a lot of really important information that we think is that stakeholders in those groups, communities would be interested in, but I'm not sure that ECHO's quite got this in their sight to be reaching out to these types of groups, if that makes sense.
Yeah, that makes sense. And Rashmi put something in the chat. Rashmi, do you want to unmute and say that?
Yeah, thanks, Levy. I'm just thinking out loud. I think there are certain levers or mechanisms within TSCA to petition for certain chemicals where there's, really strong evidence for their toxicity. And especially given kind of the racial disparities and exposures, this could be kind of a candidate class of chemicals to petition straight to risk management. I'm sure that there will be kind of caveats with that, but it's definitely something worth exploring.
Yeah, and I think, our next steps,
Yeah,
we're
really
getting.
good point.
Oh, yeah.
Go on.
In terms of the health impacts, like right now, we've characterized the exposure in this like first step, and in the next year, we should have a lot more data to support whether there's potential health effects. And so it would be really good to have that on the radar as a potential next step.
Awesome. That's great. Nicole, does that answer your question? Okay, cool. Mary also wants to know just generally exposures from melamine dishware. So she asks, does a hot liquid release a higher exposure than a cold liquid? Another kind of, I guess, exposure concerns around melamine.
Yeah, so if you go onto the FDA website, they say the leaching from the dishware should not be a huge concern, but they do say that don't mind it, and they do tend to leach out in higher temperature or hot liquid. So I think I've read a paper about how melamine exposure is probably a little bit higher in summer months, possibly due to the temperature being a little bit higher.
Then, are there any other questions? Folks wanna, either you can raise your hand or you can drop it in the chat and I can read it if you don't feel like unmuting. Going once, going twice. Okay, great. Thank you so much, Jessie and Giehae. This was an awesome presentation. And yeah, I didn't even know about this paper until I saw the blog that you posted on Pre's website, which I think we put in the reminder emails, but I'll also drop it in the chat when I get a second. But yeah, an awesome paper. So thank you so much. I really appreciate it.
Well, thanks for inviting us.